The biggest unmet need clearly is drugs that are acting on the central nervous system itself. I think we became very efficient in treating the immune system and preventing relapses, preventing lesion formation. I think that's a really achieved goal, so to say. But I think the continuous process in the CNS, both inflammation and degeneration, is only partly dependent on this de novo infiltration. And that's a process we are only starting to understand, which is probably really relevant for disability, for atrophy, so for the hard outcomes, so to say, in patients. And these probably can only be influenced by identifying and targeting crucial steps within the central nervous system, probably involving microglia, astrocytes, so new players of CNS resident cells, where there is basically no evidence that any of the established MS drugs are affecting these cells at all. Now something gets attention, which probably I would have answered 2 years ago, which is I think very important, which is degenerative measures in MS, meaning neurofilament is probably one of the most important biomarkers for a patient, because it is ultimately the one biomarker that is showing you how much CNS, or let's say how much axons are lost, meaning that either that's by lesion formation or that's by chronic degeneration. NFL, neurofilament being high is not a good thing. And so for the first time, we have now a measurement of this degenerative process within the central nervous system, and only start to understand that the drugs that we have are only partially influencing this process. And this, 2 years ago, I would have said exactly that's the marker that everybody needs to go after, and that's fortunately what happened. So right now I don't see the need yet. Maybe throughout the conference I'm identifying the next one.